Are you preparing for an interview with the National Health Service, NHS? To support you in this process, we've compiled a list of the top NHS interview questions and provided insightful answers. 1. Why do you want to work for the NHS? I have always admired the dedication and passion of NHS staff. Witnessing their unwavering commitment, especially in challenging times, has inspired me to contribute to this commendable institution. I believe that healthcare is a fundamental right, and I am passionate about ensuring that it is accessible to all. Working for the NHS would allow me to be part of a system that prioritizes patients' well-being and strives for continuous improvement. I am particularly drawn to the NHS's core values, which align with my own beliefs and ethos, making it the perfect place for me to develop professionally while making a tangible difference in people's lives. 2. What do you know about the NHS and its core values? The NHS, National Health Service, is a publicly funded healthcare system in the UK. It operates on 4 core principles. First, compassion is about treating patients with empathy, respect, and dignity. Second, inclusion focuses on providing services to everyone regardless of their background. Third, improvement aims for constant development of practices and processes for better patient care. Lastly, collaboration encourages teamwork and partnership among staff members and with patients, their families, and the public. As for the NHS and its core values, I have a deep understanding. The NHS stands for National Health Service, a public healthcare system in the United Kingdom. Its core values are compassion, inclusion, improvement, and collaboration. Compassion implies treating everyone with respect, understanding, and empathy. Inclusion means providing services to everyone, irrespective of their background. Improvement relates to the continuous development and refining of practices for better patient care. Collaboration encourages teamwork, partnership, and cooperation between employees, patients, their families, and the general public. 3. Tell me about yourself and your background. I am a dedicated healthcare professional with a passion for improving patient outcomes and the efficiency of healthcare systems. I hold a degree in health sciences and have spent the past 5 years working in a variety of roles in the healthcare sector. My experience ranges from hands-on patient care to administrative roles where I was responsible for managing patient records, coordinating care, and ensuring that all procedures and protocols were followed. I am particularly experienced in using electronic health record systems and have a strong understanding of data protection and patient confidentiality laws. In my previous role at a busy city hospital, I played a key role in implementing a new patient care coordination system that significantly improved patient satisfaction rates. I've also had the opportunity to lead a team of healthcare professionals, which has developed my leadership, communication, and team working skills. I'm always looking to learn and develop my skills further. I regularly attend professional development courses and stay updated with the latest healthcare trends and technologies. I am confident that my skills, experience, and passion for healthcare make me a strong fit for this role. 4. What skills and qualities can you bring to this role? In the healthcare industry, effective communication, empathy, and resilience play central roles. My experiences as a healthcare provider have helped me sharpen these essential skills. I am adept at conveying complex health information in a manner that is easy for patients to understand, ensuring they are well informed about their health situation. My empathetic nature allows me to connect with patients on a personal level, which I believe is crucial for their comfort and trust. Facing numerous challenges in the healthcare field has built my resilience, enabling me to handle pressure and stress with ease. I also possess strong organizational and problem-solving skills, which are vital for managing tasks efficiently and addressing unpredictable situations in a healthcare setting. 5. Describe a time when you provided excellent patient care. During my previous role in a busy healthcare facility, a patient with Parkinson's disease was admitted. She was clearly distressed, finding it difficult to communicate her needs. I spent extra time with her, using simplified communication techniques to understand her discomfort. I noticed her discomfort increased during meal times. Upon further investigation, I discovered she was having difficulty swallowing. I immediately coordinated with the speech and language team to develop a safe eating and drinking plan. The patient's comfort and health noticeably improved, and she expressed gratitude for my attention and care. This situation reaffirmed my belief in patient-centered care as a pillar of quality healthcare. 6. How do you handle stressful situations at work? When faced with high-stress situations, my approach is to remain calm and focused. I find that taking a moment to breathe and assess the situation helps me in making clear, rational decisions. Prioritizing tasks is also key in managing stress. I make sure to handle urgent and important tasks first, which aids in alleviating pressure. I also believe that communication plays a crucial role, especially when working within a team. By keeping everyone informed and seeking help when needed, stressful situations can be managed more efficiently. It's also important for me to take care of my mental and physical health outside of work. Regular exercise, adequate rest, and hobbies help me maintain balance and resilience in the face of workplace stress. 7. Give an example of when you've worked effectively in a team. Working effectively in a team is essential in a healthcare setting. I experienced this profoundly when I worked as a nurse in a busy hospital ward. We had a critically ill patient who required immediate and intensive care. The situation demanded swift and coordinated efforts to stabilize the patient's condition. As a team, we effectively communicated with each other, assigned tasks based on each member's strengths, and ensured everyone was on the same track. Through our collective efforts, we were able to successfully manage the patient's condition. This incident demonstrated to me the importance of teamwork in a healthcare environment. 8. How do you prioritize your workload when dealing with multiple tasks? To effectively manage my workload, I always begin by identifying the urgency and importance of each task. I use a method similar to the Eisenhower box to categorize tasks into urgent and important, important but not urgent, urgent but not important, and neither urgent nor important. This helps me to focus on what truly matters and not just urgent tasks. My next step is to estimate the time it will take to complete each task. This allows me to create a realistic schedule and to avoid overloading myself. Lastly, I always ensure that I leave some time for unexpected tasks or issues that may arise during the day. I find that this approach greatly increases my productivity and reduces stress. 9. What do you consider to be your greatest strength? I believe my greatest strength lies in my ability to communicate effectively with people from all walks of life. This quality has been honed through years of experience in various roles, and it's something I pride myself on. Whether I'm dealing with patients, colleagues, or supervisors, I'm able to articulate my thoughts and ideas clearly, ensuring I'm understood. Additionally, I have a knack for listening and understanding others, which makes me an effective team player. I find this skill particularly useful in the healthcare field, where clear communication can literally be a matter of life and death. 10. What area of your practice do you think needs improvement? As a healthcare professional, I believe there's always room for improvement. One area I strive to improve upon is my time management skills. While I am able to manage my tasks efficiently most of the time, there are instances where unexpected situations arise, pushing back other responsibilities. I aim to further develop my ability to adapt and reprioritize tasks swiftly in such scenarios. Also, I am committed to enhancing my expertise in the latest healthcare technologies. As medical technology continues to evolve, it is crucial for me to stay abreast with the advancements to provide the best possible care to my patients. 11. How do you stay up to date with developments in healthcare? In an ever-evolving field like healthcare, staying well-informed is paramount. I regularly read medical and healthcare journals, follow relevant news sources, and attend webinars and conferences when possible. I also participate in online forums and networks where professionals discuss latest trends and advancements. Participating in continuous professional development (CPD) activities, such as workshops and training courses, is another way I keep my knowledge and skills current. Lastly, I believe in the power of peer learning and often engage in knowledge-sharing sessions with my colleagues. 12. Describe a situation where you had to deal with a difficult patient or colleague. In my previous role as a nurse, I encountered a patient who was highly agitated due to prolonged wait times. He became verbally abusive, making it difficult for me and my team to perform our duties. I remained calm, empathized with his frustration, and explained the situation in a clear, concise manner. I assured him that we were doing our best to attend to him as quickly as possible. In the meantime, I offered him comfort by ensuring he was as comfortable as possible, offering him refreshments, and regularly updating him on the progress of his wait. This approach eased his frustration and he eventually became cooperative. This experience taught me the importance of patience, empathy, and effective communication in managing difficult situations. 13. How would you handle a disagreement with a coworker? In case of a disagreement with a coworker, I would first aim to understand their perspective by actively listening to their viewpoint. This helps in finding common ground and resolving conflict in a respectful manner. If the disagreement persists, I would then seek the advice of a supervisor or use mediation to reach a resolution. I firmly believe that a harmonious work environment is crucial for productivity and patient care. I always strive to maintain good relationships with my colleagues and handle disagreements professionally, ensuring they don't impact the work environment negatively. 14. What motivates you in your work? My primary motivation in my work is the opportunity to make a tangible difference in the lives of patients. Assisting individuals in need and seeing their health improve significantly because of my contribution is extremely rewarding. Another source of motivation for me is the constant learning and growth that comes with the healthcare profession. The ever-evolving nature of medical science means there's always something new to learn and apply in my practice. Last but not least, working in a team of dedicated healthcare professionals is both motivating and inspiring. Their commitment and resilience drive me to strive for excellence in my role. 15. Where do you see yourself in 5 years? In 5 years, I envision myself growing professionally within this organization, having absorbed as much knowledge and experience as possible. I see myself taking on more responsibilities, striving for excellence, and contributing effectively to the team. I am passionate about healthcare and patient care, so I aspire to develop in areas that would amplify my ability to deliver exceptional service. I also plan to pursue continuous learning, attending trainings, and keeping myself updated with the latest healthcare advancements. My goal is to be an integral part of the team, leading initiatives that would enhance patient care and satisfaction. 16. How do you ensure patient confidentiality and data protection? To ensure patient confidentiality and data protection, I follow several key steps. Firstly, I adhere strictly to the guidelines set by the Information Commissioner's Office. I only access patient data when necessary for my role, ensuring there isn't any unnecessary exposure of sensitive information. Additionally, I use encrypted systems for transferring data and make sure that any physical copies of personal information are stored securely. I am also careful about discussing patient information, ensuring that such discussions are kept professional and only take place in private settings away from unauthorized individuals. Regular training and staying up to date with data protection laws is also a part of my strategy in handling sensitive data responsibly. 17. Describe your experience with electronic health record systems. In my previous role as a healthcare administrator, I extensively used electronic health records, EHR, systems. My responsibilities included entering patient information, updating medical histories, and scheduling appointments. Through this experience, I gained proficiency in various EHR software, including Epic and Cerner. This experience also made me adept at ensuring accurate and timely data entry, which is crucial for providing optimal patient care. I also became familiar with maintaining data privacy and confidentiality, aligning with HIPAA regulations. I believe that my proficiency with EHR systems can greatly contribute to streamlining the processes in your organization. 18. How would you contribute to improving patient safety in our organization? As a healthcare professional, my primary commitment is to ensure safe and exceptional care for patients. I believe I can contribute to patient safety by promptly reporting any observed risks or potential safety issues. I also aim to promote a culture of safety by educating colleagues about the importance of following safety protocols, including proper hygiene practices and correct use of equipment. I am a strong advocate of continuous learning and will stay updated with the latest research and guidelines on patient safety. By doing so, I can incorporate these best practices into my work and share the knowledge with my peers. I would also actively participate in safety audits or quality improvement projects within the organization. My proactive approach and commitment to patient safety would be beneficial to the organization. 19. Give an example of when you've gone above and beyond for patient. There was an instance in my previous role where I had to handle a patient suffering from dementia. She was extremely distressed due to her unfamiliar surroundings and was refusing to eat or take her medications. As it was not part of my job requirement, I decided to spend my lunch breaks with her, talking to her about her family and her interests, and reassuring her that she was safe. Gradually, she began to trust me and started accepting food and medicines from me. By going beyond my defined duties, I was able to provide her with the care she needed, which had a significant positive impact on her health during her stay at the hospital. 20. How do you maintain work-life balance in a demanding healthcare role? A healthy work-life balance is essential, particularly in demanding healthcare roles. I ensure this balance by setting boundaries between personal and professional time. Clear communication with my team about workload and capacity is key. Regular breaks and self-care activities like exercise, hobbies and spending time with loved ones help me stay refreshed and focused. I also use tools and strategies to manage my time effectively, such as prioritizing tasks, goal setting and smart planning. Finally, I stay flexible and adaptable, recognizing that each day may bring new challenges and demands. 21. What do you think are the biggest challenges facing the NHS today? In my perspective, one of the most significant challenges confronting the NHS today is the continuous demand for services against limited resources. This includes the need for innovative solutions to manage the increasing complexity of patient needs, given the growing aging population with multiple long-term conditions. Another major challenge is the retention and recruitment of healthcare professionals. Staff shortages can have a significant impact on the quality of care provided to patients. Additionally, the constant changes in technology and healthcare practices require the NHS to adapt quickly, which can often be challenging. Lastly, the ongoing effects of the COVID-19 pandemic has put immense strain on the NHS, amplifying the aforementioned issues. 22. How would you handle a situation where you witnessed unethical behavior? I would first ensure that what I witnessed is indeed unethical by clarifying the situation and verifying the facts. If confirmed, I would report the incident to my immediate supervisor, as it is their responsibility to address such issues. However, if my supervisor is the one involved in the unethical behavior, I would report to the next higher authority or use an anonymous reporting system, if available. It is crucial to follow the organization's policies and guidelines when handling such matters. I believe that maintaining a culture of integrity and ethical conduct is vital in a healthcare setting, and I am committed to upholding these values. 23. Describe your approach to providing compassionate care. When providing compassionate care, I focus on understanding the patient's needs and emotions. I make it a point to listen attentively, showing empathy and patience. I believe that every patient deserves to feel heard and understood, which is why I always take the time to establish good rapport and trust. Additionally, I ensure that I communicate in a clear and respectful manner. I acknowledge the patient's feelings and validate their concerns, always making sure that they feel supported during their healthcare journey. I also make it a point to provide comfort and reassurance, especially in stressful situations. Ultimately, my approach to compassionate care is built around the idea of treating patients as individuals, not just as cases or numbers. I strongly believe that everyone deserves care that is personalized, empathetic, and respectful. 24. How do you adapt to changes in policies or procedures? In rapidly evolving fields such as healthcare, adapting to changes is not just preferred, it's essential. My approach towards policy or procedure changes is rooted in understanding, flexibility, and communication. First, I make an effort to fully comprehend the reason behind the change and its implications. I believe that understanding the why of a policy helps in better implementation. Next, I demonstrate flexibility in not just accepting the change but also in modifying my work habits, if necessary, to accommodate the change. Finally, I maintain open lines of communication with my superiors and coworkers. This helps me to clarify any doubts, share my own experiences, and learn from those of others. By doing so, I can ensure that I am adapting in the most effective way possible. Understanding these questions and formulating your responses ahead of time will undoubtedly increase your confidence and performance. Don't forget to consider the behavioral qualities the NHS is looking for and weave these into your answers. If you found this video helpful, please give it a like and don't forget to subscribe for more insightful content. Good luck with your NHS interview.